Extract 1. Questions 1 to 12.
Hello, Doctor. Good morning.
Yes, good morning. What's your problem?
Well, Doctor, I have a sinus problem. I get postnasal drainage, facial pain, headaches, sore throat and congestion.
Since how many days have you been facing this problem?
For the past 2 weeks, Doctor. I'm also getting snoring, teeth pain and nasal burning.
Is it moderate or severe?
It worsens in the evening and morning.
What's your age?
47, Doctor.
Did you have any illness previously or any surgeries?
Yes, surgeries, gallbladder and hernia.
Do you drink, smoke?
I don't drink, but I smoke 1 pack of cigarettes per day for the past 15 years.
Any of your family members have any illness?
Yes, I have a family history of allergies and hypertension.
What are the medications you are taking?
Claritin, Dilantin and Rhinocort nasal spray.
Are you allergic to any medicine?
No, Doctor.
Well, your auricle's external auditory canals reveal no significant abnormalities bilaterally. TM's intact with no middle ear effusion and are mobile to insufflation. Your intranasal exam reveals moderate congestion and purulent mucus. Your orophonics examination shows teeth, alveolar ridges reveal missing molar. Examination of the posterior pharynx show a prominent uvulva and prominent postnasal drainage. The palatine tonsils are 2+ and cryptic. The palpation of anterior neck reveals no tenderness. Examination of the posterior neck shows mild tenderness to palpation of the suboccipital muscles. Facial examination shows there is bilateral maxillary sinus tenderness to palpation. Waters View X-ray reveals bilateral maxillary mucosal thickening. You have acute maxillary sinusitis, 461.0. Snoring, 786.09. Well, I am prescribing you Augmentin, 875 milligrams twice a day, and Mucofen, 800 milligrams twice a day. Follow these medications for 3 weeks and meet me after that. If the conditions don't improve, then I will order a mini sinus CT.
Extract 2. Questions 13 to 24. You hear a speech therapist talking to a patient, Rana Anderson. For questions 13 to 24, complete the notes with a word or short phrase. You now have 30 seconds to look at the notes.
I must say I'm a little nervous. I've not experienced anything like this before, and as a singer-songwriter, I depend on my voice for my livelihood. I don't know how much longer I can feel like this. This choking sensation is bizarre to me. I don't want to be going through this for much longer. It's getting me down.
Nobody does, Mrs. Anderson, and we'll get to the bottom of this. You know, your voice problems, both speech and singing, are connected to everything. How you're feeling, what you're eating, everything. Tell me more about how you're feeling.
Weren't you listening to me? I feel dreadful. I can't do the thing that I've been doing for the majority of my adult life anymore, and it's an awful experience. To make matters worse, the sound of my voice has completely changed. My fans wouldn't recognize it if they heard me on the radio today. Do you have any idea what that feels like?
I'm so sorry that I don't, Mrs. Anderson, but I'd like to help if you'd let me. You said you noticed some changes. I understand that. Does this happen at a particular time of the day?
Mostly around mealtime. I notice both abnormalities immediately after I swallow something. I've no idea whether there's a connection, though.
I suppose what I don't understand is how this could have happened out of the blue like this. Has something like this ever happened before?
Not really. In fact, there's nothing remarkable, if you will, about my medical history. Since the stroke in '06, I've had no need to come here.
But it says you visited the clinic earlier this year.
Oh, yes, I had dysphagia, but other than that, nothing else out of the ordinary. I exercise regularly, don't smoke, haven't ever touched a drop of liquor either.
Okay.
I fear that my social life's going to take a hit. I used to be quite the social butterfly, outings, signings, concerts, even mingled with the locals by attending coffee mornings. Now I'm lucky to even get invited anywhere. I used to be the Rana Anderson. Now my so-called friends walk past me in the street. They don't even invite me walking in the mornings anymore.
I feel for you, Mrs. Anderson. Really, I do. Are there any other social events that you feel you can participate in?
Does smoking count? I enjoy joining the girls to do a bit of that.
That's hardly good for your voice.
That's true. Oh, I like prunes.
Oh.
Yes, sometimes I meet up with friends to try new varieties. Raw, shakes, and cocktails are on the menu.
That sounds lovely. I hope you keep doing that. If you don't mind, I'd like to make some observations and run some tests. This requires me to observe you trying this platter here.
This one? Oh, wow, everything looks so yummy. I think I'll try a bit of this one here.
That's lovely. Now, whilst you're eating, I'd like to watch your breathing pattern to see if there's anything unusual. I'll do this for 10 to 15 minutes, and if necessary, I think what I'll do is prescribe you with some thickener.
What's that?
It's a way for us to increase the consistency of what you decide to eat.
That is the end of
Listening Part B. You hear a junior doctor speaking with a patient in the cardiac clinic while a consultant is present. Now read the question.
Hello again, Mr. Waits. We met last week, didn't we? I've been telling my colleague here about you. I've seen the results of the tests, but there are just 1 or 2 points I'd like you to clarify for me and for the benefit of Dr. Granger. You did say that this pain and discomfort has troubled you for nearly 8 months and is getting worse?
That's right, Doctor.
Can I get you to describe the character of the pain, or in other words, tell us what it is like exactly?
It's not always a pain as such. Often it's a feeling of discomfort in my chest, like someone's pressing down on it.
What about your breathing when you get the pain?
I don't notice any difference.
Now, what would happen if you and I and Dr. Granger here went for a walk up the hill to the station?
What's that now?
I just mean, if we were to walk, what do you think would happen? Do you think you could keep up with me if I walked fast?
Oh yes. Well, last summer I climbed up Ben Nevis in Scotland, so I've no problems there.
Listening Part B. You hear a senior nurse talking about removing sutures to a group of students. Now read the question.
When removing sutures, firstly put on your apron. If you have long hair, be sure that it is tied back securely. Explain to the patient that you're going to remove their sutures. They'll probably use the word stitches. Secondly, ask them if they're comfortable. They may ask if the procedure will hurt. Reassure the patient that removing sutures doesn't hurt. Third, perform hand hygiene. That means washing your hands thoroughly and drying with a paper towel. Then prepare your equipment, including some gauze, cleansing solution and stitch cutter on a sterile tray. Put your hand inside a sterile waste bag and use it like a glove to remove the bandage from the sutures. Turn the sterile bag inside out so that the bandage is now inside the bag. Put on your sterile gloves. Finally, look at each suture and check that inflammation has not occurred.
Listening Part B. You hear a staff nurse talking to a patient she is escorting to the radiology department. Now, read the question.
Hi Jake, it's time for your x-ray now. Are you ready?
Oh, okay.
Can you walk to the radiology department, do you think?
Is there a wheelchair or a walking stick maybe? I'm a bit weak this morning.
There's a wheelchair.
Oh, that'd be great, thanks.
Of course. Let me help you. There you are. Are you warm enough?
I'm a bit cold actually.
Let me get you a blanket. There. Is that better?
Thanks.
And I just need to see your identity bracelet, please. Thanks. What's your full name?
Jake Peterson,
Your date of birth?
18th of January 1982.
Okay, thanks.
Listening Part B. You hear a nurse talking to a patient in the recovery unit. Now read the question.
Mrs. Wendell, can you hear me?
Yes.
I'm your recovery room nurse. Your heart bypass surgery went very well.
Oh, good.
I'm going to be taking your vital signs every 15 minutes and be checking your oxygen levels. The mask you're wearing will help with that. Can you breathe all right?
Yes, but my chest hurts.
On a scale of 1 to 10, with 1 being no pain at all and 10 being the worst pain, what number do you think your pain is right now?
Oh, I guess about 4 or 5.
Okay. And do you feel nauseous?
No, but I feel cold.
Listening Part B. You hear the beginning of a training session for doctors. Now read the question.
The function of the endocrine system is to regulate the various organs within the body, and it does this by using hormones, which are produced by glands. Today we are going to look at ways in which the endocrine system can malfunction and the effects that that can produce. I would like to begin by looking at the functioning of the thyroid gland. This is one of the largest glands in the body, and it is located in the neck below the mouth. It produces a number of hormones, the most important of which are T3 and T4.
Listening Part B. You hear a doctor talking to a nurse about a patient called Mr. Kransky. Now read the question.
Can you tell me how Mr. Kransky's doing?
Mr. Kransky? He's doing quite well, but he still has difficulty swallowing.
Has he seen the speech and language therapist yet?
Yes, he sees her every day to do tongue exercises to help his swallow reflex.
That's good. What type of diet is he on now?
He started on a puree diet yesterday.
How's he managing with it?
He's managing it quite well.
What about the fluids?
He's still having thickened fluids and he's coping quite well with them.
Okay. Can he feed himself yet?
No, not yet. He still needs help.
Okay. I'll write up a referral to the OT.
Thanks. Maybe she can bring a few things to help him feed himself.
Right. Can you keep him on the puree diet and thickened fluids until his swallow reflex is better?
Sure.
I'll review him at the end of the week.
This is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Extract 1. Questions 31 to 36. You will hear an interview with a midwife called Christina Morello, who's talking about the time she spent working as a volunteer in South Sudan. You now have 90 seconds to read questions 31 to 36.
Today we're talking to Christina Morello, who's recently returned from South Sudan, where she was working as a volunteer midwife in a field hospital. Christina, could you tell us why you wanted to go and how you felt?
Well, I first arrived at the decision because I was dead set on making a difference to people who had nobody to turn to in desperate times. And, to be honest, from a selfish point of view, I naively thought it would be an adventure. I was just worried that the charities wouldn't need midwives. You always hear about the huge demand for nurses, and my experience lies in delivering babies. My parents, on the other hand, were terrified. They understood the risks better than me and realised that I could be working in very dangerous settings and that I hadn't properly prepared myself. They also warned me about homesickness and being away from my family for so long, something I hadn't really considered until they brought it up.
So, was your role in Sudan very different to the one you'd been doing in the UK before you left?
Very much so. The role entailed a huge variety of tasks, and they were all demanding in different ways. I helped set up maternity departments and trained local midwives in rural health centres. That was incredibly rewarding.
Yeah.
Watching my knowledge and expertise being passed on to other midwives and seeing them help the women in very remote areas who would otherwise have no access to maternity services felt so satisfying, like I was really making a difference. But what really shocked me was the sheer volume of deliveries I was dealing with. It was astonishing. There seemed to be a never-ending stream, and a lot of them were complicated. I regularly worked 36-hour shifts.
Oh, you mentioned that a lot of the deliveries were difficult. Could you expand on that for us?
Yes. Deliveries that I used to see as complicated back home became almost routine for me. I saw breech deliveries, twins, ectopic pregnancies, eclampsia, pre-eclampsia, and face presentations on a daily basis. And not only that, but all of these extremely dangerous situations have to be dealt with using very little medication, and you're sharing your kit with a team of people who are also working under extreme pressure. There's a desperate lack of funding for clinical equipment, which is why our work is so important. People don't use contraception, and they have huge families. The more children a mother has, the more complicated the delivery. In South Sudan, up to 13 children isn't uncommon, and that often leads to difficult and dangerous births.
Could you tell us about a patient who made a particular impression on you?
I remember when one patient, let's call her Margaret, came to the hospital in labour with twins. When we examined her, it became apparent that she needed an urgent caesarean section. This was impossible, as there was already one being performed, and we simply didn't have the staff or equipment to handle two simultaneously, or to do a turnaround in time.
Right.
We had to work quickly together, overcome any language barriers, and really cooperate with each other to make sure that the necessary equipment was sterilised and available as soon as possible. I think Margaret's case really demonstrates how teamwork is everything out there. Eventually, the babies were both born naturally, safe and well. That was one of the happy endings.
It must have been quite a culture shock for you. What was most difficult for you to get used to?
I was in what's called a medium-risk placement, which meant that fairly strict rules applied, and that took some getting used to. We weren't allowed to leave the hospital complex after nightfall, which was strange, but not too much of a problem, as I was usually only fit to have dinner and fall into bed anyway. The worst thing was constantly feeling dirty and uncomfortable. There was no break from the heat and humidity, and we only had bucket showers and a limited water supply. The bugs didn't help matters. They really added to the discomfort, and everybody always had something or other to complain or worry about. A sting, a bite, an itch or a rash.
So what qualities would you say are the most valuable for anyone who is thinking of volunteering?
Obviously, you can't apply unless you have all the qualifications, experience and skills that they're asking for. That's a given.
Right.
Language skills are a huge bonus. If you've even the most basic grasp of the local language, it'll get you out of all sorts of tricky situations. But what you really need is the ability to cope with the unexpected and be up for anything. When you're working in such extreme conditions, your team's the only thing that keeps you going. So if you put up obstacles, you'll cause more problems than you solve.
Now look at extract 2. Questions 37 to 42.
Hello, doctor. Can you please explain different types of epidermal nevi?
Epidermal nevi are categorized based on their clinical features, by the site of occurrence and their extent of spread. However, mostly they are categorized based on the epidermal cell that predominates in the lesion. In certain patients, multiple epidermal nevi occur along with systemic abnormalities, and they form the epidermal nevus syndromes. Based on the occurrence patterns, epidermal nevi are categorized differently, despite the similarity in their microscopic appearance. Nevus varicosus occurs as a single or multiple lesions, but always localized. Nevus urineus laterus occurs as a linear pattern of lesions. Ichthyosis hystrix are generalized lesions. However, epidermal nevi are also classified by their cell of origin. Nevus sebaceous are quite common and are made up of sebaceous glands with or without hair follicles. They're found commonly on the scalp, but also on the extremities or trunk, and are pale yellow in color, with a smooth, hairless surface. They are present in infants, though they may manifest only after puberty or in childhood. 1/4 of the cases eventually give rise to tumors, and are mostly benign. Often it is connected with the occurrence of Schimmelpenning syndrome, phacomatosis, pigmentokeratotica, didymos-aplastic sebacea, and scalp syndrome. Keratinocytic epidermal nevus are also called non-organide epidermal nevi, and are quite common among this group of lesions. They follow the lines of Blaschko and begin as brownish macules, thicken and darken with age to become plaques. They may be defined as linear or varicose based on their appearance. Other variants include the epidermolytic epidermal nevus, the acantholytic epidermal nevus, and the systemized epidermal nevus. Nevus comedonicus are formed of proliferated dilated keratinized follicles. often inflamed or showing signs of infection as a result of blockage, forming blackheads, and pitting is often seen. It may be associated with brain abnormalities, bone defects, and cataracts. The Angora hair nevus is remarkable for the long and soft white hair, like Angora wool, that grows from it. It may be associated with other defects of the brain and bones. The Becker nevus is a dark patch of hairy skin that appears like a checkerboard shape, becoming larger and darker after puberty due to androgen-dependent nature. Often it is found on the upper part of the back or on the shoulders. It is linked with other skeletal-muscular defects, forming the Becker nevus syndrome. Inflammatory linear varicose epidermal nevus is linear and forms plaques, usually unilateral. They are usually pruritic and appear inflamed and hyperkeratotic. The first appearance is after 6 months of age. Porokeratotic eccrine nevus appears as warty keratotic papular lesions, mostly on the palms and soles, but in some cases they may appear all over the skin.